A new study has shown promising results suggesting that the Pfizer and Moderna COVID-19 vaccines are indeed safe for pregnant women. And it took a while to get that, and pregnant women had been asking for some time. And we have a little backup on this with Dr. Patrice Harold, an OBGYN from DMC Hutzel Women's Hospital. Dr. Harold, welcome to the Paul W. Smith Show.
Thank you for having me, Paul.
It is my pleasure. It was a big question. This report looked at 35,000 U.S. women, found the rate of miscarriages and other pregnancy complications weren't noticeably different than before the pandemic.
Right. You're absolutely right. So looking at the V-Safe information, I think women should feel more comfortable getting the vaccine in pregnancy. I mean, it's highly recommended by myself and the American College of OBGYNs that women do get the vaccine, because we do know that women who do get COVID and who are symptomatic have worse outcomes in pregnancy versus their non-pregnant counterparts. Therefore, we highly encourage that all pregnant women look at the data and get the vaccine.
And I guess like everyone and everything in something that's brand new to us, as this virus is, even a year later, there were months of confusion and doubt among pregnant women over whether to get vaccinated against the coronavirus. But it's now official. In fact, we heard Rochelle Walensky, the CDC director, and I know they've made a lot of mistakes, but we've heard from her that, quote, importantly, no safety concerns are observed for people vaccinated in the third trimester or safety concerns for their babies. And let's face it, that's what every mother wanted to know. And had you seen, Dr. Harold, in your practice, women saying, well, I understand the importance of getting vaccinated for myself and my health, but I'm not going to do it until you can tell us that it's okay for the baby?
Absolutely. Obviously, pregnant women are very concerned regarding their unborn child, and they try to decrease any type of risk that can cause harm to their baby. Obviously, we do know that COVID is a game changer. Because women who do get COVID, like I said, have risk are greater. They have worse outcomes, not just for them, but for their babies. The babies are born usually can be premature, which can cause a lot of problems, and then be exposed to the virus. Therefore, when women who are pregnant, it is important that they look at this new data that came out with the safe information, and they can feel assured that this vaccine is safe. It's effective, and it can help prevent them and their babies from some adverse outcomes.
That's a very good point. Dr. Patrice Harold, an OBGYN from DMC Hutzel Women's Hospital, the research has shown that there could be that further benefit by getting vaccinated while pregnant, that women who get the vaccine while pregnant actually pass their antibodies on to their newborns. These are some kind of recent studies suggesting this, meaning babies could get some protection from the coronavirus from their mothers. And as you just point out, that's a very positive result.
Absolutely. And this is what I stress to my patients, saying that there has been some data that show that women who did get the vaccine early on, like in January, they're delivering now, and some of these babies are born with the antibodies. So that's a plus, not just for you, but for your baby, to protect your baby for those, first couple of months of life where they need that protection against these viruses.
So with Rochelle Walensky of the CDC saying no safety problems in the third trimester, are we saying, as far as you know, Dr. Harold, it's thought to be safe at any point in time? So a woman who is planning on getting pregnant, a woman who is pregnant, at any point in time, according to the information we currently have, it should be absolutely safe.
Yeah, absolutely. In any trimester, I agree. Before pregnancy, in any trimester, it is shown to be safe to receive the vaccine.
And the reaction, getting the shot, apparently about the same. Some of the things that are happening, side effects. Pretty much pregnant women experiencing the same side effects as others following the vaccination.
Yes, I do believe the V-Stave trial did show they may have more tenderness in your arm, but other than that, the fever, the aches, the pains were generally same for the general population.
All right. And any effect if you're breastfeeding?
No, it is recommended in breastfeeding also. Again, the vaccine could potentially cause antibodies to be in the breast milk, and those could be passed on to the young infant also. So it's highly recommended in lactation also. All
right. Anything else we need to know, doctor, before we let you go?
Remember, this is an individual decision, and women should look at the data and make their decision, and then the physician should support them no matter what they decide to do.
Okay. Very good. Dr. Patrice Harold, OBGYN from DMC Hutzel Women's Hospital, as we continue on the Paul W. Smith Show at 7:27.